Hey friends, it's Michael, a licensed physio with Total Physical Therapy, and today we have a little bit of a role reversal. You see, I am going to be the ones asking you a question. Now, most of the time in front of this camera, I am sitting here answering your questions, but there are times where I'm left scratching my head looking for answers, and in this case, I'm hoping to receive those answers directly from you, our dedicated following. Now, my question is simple, and it's around the concept of placebos or sham interventions. And for those of you unfamiliar with those terms, these are typically procedures that have yet to be established in the current medical literature to be consistently safe for the public as well as consistently effective at producing the desired outcomes that you look for. So around this subject matter, my question is simply, if you were going to be exposed to a placebo, would you want to know ahead of time, or are you more focused and content with just simply getting a desired outcome? You see, I work in a profession where everything that we do is surrounding the concept of evidence-based practice. Again, these are interventions and procedures that have consistently been shown in the research to be safe and effective at producing the desired intended results. But even with that being said, what I see most often being utilized and applied by the public are non-evidence-based interventions, and this is for many reasons. I think one of the biggest reasons is because we all get slapped ad nauseum, constantly, endlessly, with marketing strategies to implore a bunch of these strategies and procedures. And so I have a specific example, and it's one that's pretty common, and for me it's just a head scratcher. So this hence the reason why I'm asking for your input. So the example is this. The example was an individual that had a joint sprain. This is a disruption to a ligament that adjoins two bones, helps to provide stability and provide controlled motion of one of your joints. And on average, the majority of sprains in the human body take about 3 to 6 weeks for healing time frame. Now I'm going to come back to that. That range is important. Again, on average, 3 to 6 weeks would be adequate time for a sprain to heal in the human body. Now, in this particular case, an individual had a successful attempt at utilizing one isolated intervention. This one isolated intervention is considered by the majority of payer sources to be experimental, and there's not solid concrete evidence to suggest that it is something that's evidence-based. Now, as I said in the beginning, just because it's not evidence-based does not mean that there is potentially value from it, and it doesn't mean that you can't benefit from it. It's just that the probabilities are not yet established. Now, in this specific case, this intervention, however, is not something that's new, that's lacking studies. It's something that's actually been around for multiple decades, and sadly, I see it come back in waves. It's usually marketed a little bit differently after we kind of forget about it. For lack of better description, the public will forget about it, and then it gets marketed very heavily, and then everybody thinks it's something new, special, and it's going to be the savior of all of our ailments. So the actual intervention is not what is important, but what is important in this instance is the fact that it's been around a while, a very long time, over 30 years, and it still has no clinical significance from an evidence-based standard. Yet this individual received on multiple occasions, they received this isolated intervention over a 2.5 month period. That's 10 weeks. I want to take you back to what I said moments ago. The individual had a condition and all of the variables that would hold true with an average healing time frame of about 3 to 6 weeks. However, this individual paid cold, hard-earned cash, about $1,000 altogether, over a 2.5 month period, and was happy. They were satisfied with the results they got. They claimed that every time they got the intervention, that there was pain relief, there was improvements to their swelling, as well as improvements to the range of motion. They felt like the place was warm, exciting, inviting, friendly, smiling, happy faces. In my opinion, that should be every healthcare facility that you choose. It should be welcoming and inviting, because you're at a disadvantage of either having pain or having some type of disability that you're seeking help from. And what better place to get that help than from a welcoming environment? But as I mentioned, 2.5 months into this, they felt like they were about 80% returned, which is when they came to us. So this was a moment where just hearing this individual's story was something that was a little disheartening to me, and something that I just swallowed and didn't want to share with this individual in this particular moment because they were satisfied with what they had gotten previously. However, it was just a very simple understanding of normal anatomical physiology, as well as simple mathematics that suggests that in 3 to 6 weeks that sprain should have been very greatly healed, even in the absence of 2.5 months and $1,000 later of non-evidence-based intervention. In that case, in that moment, if that was you sitting in front of me, would you wanted to hear the presence of a placebo intervention, or would you just quite simply want to be content with the fact that you've got the majority of the results, if not all the results you were looking for? So I'm going to be eagerly awaiting those responses. Are you that individual that just wants to know they want a result they're seeking and you don't care what the cost or the associated actions are with that? Or are you the individual that wants to know, I want to know there's some type of science behind what we're doing and that we're not just blindly throwing darts at a dartboard? Flood me with those comments down below. Help me understand what you think as the common public, because I'm going to be biased in this subject matter because I practice in an evidence-based approach and I have a very hard time opening my opinions towards these interventions that have been around for so long, and I see them marketed heavily every 5 to 10 years and just kind of steer us away from what we truly are most likely to get value from. So as always, have a beautiful day. Feed me your knowledge down below. I love starting thought-provoking discussions like this. We'll talk to you guys soon.